So there are some issues that I experience even now as a medical biller. It doesn't matter how long you've been a biller, but I believe that these 4 things that you probably have experienced at some point in your career or you will experience if you become a medical biller. And I'm going to let you know what those 4 things are and maybe some things that you could do to get over these issues. Keep watching. And the first issue is a procrastination issue. Now, procrastination is something that you probably have done, whether it is as a biller or just in general. But procrastination is not good overall. Especially in billing, there are time-sensitive duties that need to get done at a particular time. And the more we procrastinate, the more things get left behind and don't get done, which means that we lose some money in some type of way. Now, sometimes you procrastinate because you don't like a specific duty. And I did a video on the things that I hate about medical billing or something like that, and I'll link that above. But it spoke about, some of the duties that I didn't like to do as a medical biller. But whether or not I like to do them, they need to get done because that's my job and they need to get done. So here is what you can do to stop procrastinating as a medical biller. The first thing is to eat that frog. And I don't know if you have read the book, Eat the Frog. I read it a couple years back. But basically what he was saying was do the thing that you really don't want to do first. So whether that's frustrating or it's just something really big, imagine if you have a big payment posting project that you have to do and you just keep putting it off, putting it off, putting it off. Instead of doing all the other smaller things or easier things that you have to do or more simpler things that you have to do, do the thing that you don't want to do first so that you can get that out of the way and feel accomplished. And something that I might add to that is to check your energy. Make sure that your energy level is high. For me, I love to do things straight in the morning, like early morning, because that's when I feel like I have the most energy. So from about 5:30 till about 11:30, 12 o'clock, I think I have the most energy. That's when I want to do the thing that is the hardest or the thing that I find most frustrating or the biggest project that I have early in the morning. Now, your energy might be better in the afternoon or in the evening. Maybe you might be a night owl. Choose when is the best time to do it and get it done. Stop procrastinating when it comes to billing because, again, you will be losing money and we don't want that to happen. And the second issue is delegation issues. Now, I have spoken to other billers and I feel like we have something in common. So let me know if you also have this in common. But I tend to want to control everything around me that deals with my billing per se. So, if it has to do with claims and, sending out statements, I can give you an example. I just started working in a new system called Athena, and they help you send out patient statements. At least that is what the package that the provider that I work for has. And so they send out statements. But I am used to sending out my own statements because I like to go through each and every patient's account, make sure that the statement that I send out or that I'm sending out is correct, and then send it out. But with Athena, they just do whatever, post the payments, do whatever, and send out statements. And now we're getting a lot of patients complaining about the statements coming and why do they owe this and all of these other things. And I have a control issue because I like to make sure that things are done right the first time. Now, of course, I make errors and things, slip me and stuff like that. But I like to make sure that things are done correct the first time so we don't have to deal with this on the back end. And especially not to have the patients calling you upset, wondering where is this bill from. I did a video about that. I'll link that above, where you don't want patients to be calling you because if they tend to get statements that are incorrect and then you tell them that the statement is wrong, when they get a statement that is correct, they're probably not going to pay it. And that's not going to be a good thing. So I have to learn to delegate duties and release my control. I also need to understand my role. Now, as a medical biller, sometimes you can get caught up in different roles. So you can be titled a medical biller, but you're also coding, and you're also doing the bookkeeping, and you're also doing front desk duties. Like, you could be doing a lot of things that connect to you, because all of these other duties or all of these other titles, they connect to billing. So you can get caught up in doing that. You also need to learn to let that go, delegate what needs to be delegated. So for example, if the front desk is doing eligibility and they're supposed to be checking the patient's eligibility, verifying benefits, checking to see what their copays and coinsurances and all of that is, and they come to you asking you a question, teach them. Tell them what they're supposed to do, but then let them do it. I know sometimes as a biller, you might say, let me just do this myself, because trust me, I do that all the time. Let me just do this myself. I know what to do, and they'll do it the next time. But if you continue to keep doing it, then they will never learn what they have to do. They will become accustomed to you doing it, and they will continue to bring the issue to you. So make sure that you delegate duties that can be delegated. Now, there are some that you need to do that it requires your hands-on knowledge or whatever of it, but learn to delegate and let go of certain issues so you won't have so many duties piled up on your back, especially if you are the only biller, maybe in a big practice, or you're doing a lot of other positions. So comment below if these issues also pertain to you. And I have 2 more comments, so also let me know if those pertain to you. If I'm alone and these are just about me, because trust me, all 4 of these are my issues that I need to deal with, then I'm alone. But I really feel like you may also have this issue. So comment below. The third issue is being in your personal feelings issue. I didn't know how else to say that one. But as far as that one, I feel like sometimes you can get so caught up or so serious about your billing that you tend to take it personal. Now, for me, I know that this is in a way personal to me because it's my job, it's my career, I love it, I'm passionate about it, so I tend to get personal. But to be honest with you, you should not get personal at all. It is a job, or it is a career, and you shouldn't let it get personal to the point that it starts to affect how you feel. So for example, sometimes when you're dealing with a patient-specific case and you're trying to maybe get a claim paid for this patient because you know that maybe the patient can't afford it and the insurance company is not paying, they keep denying, they really need this service, it can tend to get really, really personal. Sometimes you might know somebody personally in your life who's in the same situation, and so you take it personal. But you have to remember you need to kind of get out of that personal box, which is really hard to do, but you get connected to patients in that way. And that also brings me to getting connected to the provider. Because if you are billing for a provider, and let's say you've billed for this provider for a long time, or maybe you and the provider know each other personally, you tend to take your job really serious and really personal. So when they're not getting paid, when there's a credentialing issue, when there's something that is an issue for the provider to not get paid or the patient to not get their services paid, then you may tend to take that very, very serious. Or maybe I should say, I tend to take that very, very serious. So there is a personal issue problem that I have that I need to work on, and maybe you do too. So let me not forget to mention my online shop where I have medical billing merchandise, which this shirt is one of them. I will leave the link on the screen. And I have several other designs. I have notebooks, cups, different things for us medical billers, because if you love medical billing as much as I do, then you want to represent. This t-shirt is from Medical Billers Day, which was March 28, 2024. And if you have not watched my series leading up to Medical Billers Day, then you probably should. I'll link that above. Check out the shop, pass it along to someone who you may know who's a biller, or you're a biller. And the fourth one is having open-mindedness issues. I don't know if I said that right. But what I actually mean is making sure that you are open to learning new things and remembering that things always change and not every biller does it the same. Now, if you have been in the billing space for a while, you tend to get familiar with how things go if you're in a specific specialty, or whatever it is, you've been in it for a while, so you feel like maybe you're in a specific state, so you feel as if this is the way to do it. But you have to keep an open mind and always remember that things are not black and white, and there is always going to be something that changes. So even if you speak to another biller and they say they fill out the claim form this way for Blue Cross, you might fill out the claim form a different way for Blue Cross. And this might only be just for your local Blue Cross, and they fill it out a specific way for their local Blue Cross. So you have to make sure that you are open-minded and that you are willing to learn new things and realize that things are going to be different for different billers. And I'm saying this because I'm at that space right now where I'm learning a new system. And as billers, we can tend to work in a lot of different systems. We may work in one system. And if you work just in one system, you may believe that this is the only way that it needs to go because that's the only system that you've worked in. But now, if you've changed over, maybe the practice has changed over, maybe you have decided to branch out and now you have another provider and now you have a whole nother system, things can be completely different and go haywire. So you have to open up your mind, release all of the things that you may have known before, and try to open up and learn new things. Another thing about being open-minded is with the automation. All of the different types of automation systems and processes and all the things when it comes to these practice management systems, you may be accustomed to doing it one way. And I will give you an example, which I think I gave earlier about the patient statements. I remember when I used to send out the patient statements by hand, by paper, mail them one by one. Now there's a faster way to do it. And for a while there, I was just like, I don't want to do it that way. I don't want to do it that way. I know this way is right. This is my way. It's been working. Why are we changing it? But we're changing because the world is changing and it's evolving. So we have to change and evolve with it. So if you like this video, then you will love this video where I talk about the one thing you need to become an amazing biller. And you'll be amazed at what that one thing is. See you in my next video.